Hi dudes, how are you all? I hope everybody doing well. Today let us see another one Oet letter. This letter is focused on one patient, diabetic patient with type 2 non-insulin dependent diabetes. And the registered nurse would like to write an official letter to a public health nurse to monitor her compliance on medication and exercise programs and diet control because she is in compliance on all these things. So, and her condition is, since her condition is worsening, she just want to help her through the public health. So this is the content of the letter. Let us see how to write an official Oet letter to a public health nurse. Address part. So you can see the address is, and the date and address is 4 July 2021. There is no comma in between. And the address you can just copy from your writing task. Miss Sheila Mansoura, Public Health Nurse, 125 Canterbury Road, Ringwood, Victoria, 3134, Australia. Next, we will go to the salutation. Dear Miss Mansoura. So we have to write the surname, only the surname. And regarding the patient name, Miss Beverly, Mrs. Beverly Williams. Next one is our important paragraph. This is the introduction paragraph, or we can call it as like a purpose paragraph. So here we are going to write 3 sentences. The first one, the patient, we are introducing the patient and with the recent present medical condition. Second one is the requirement. Third one is the discharge or status. So how we can write, I am writing to refer Mrs. Beverly Williams who has type 2 non-insulin dependent diabetes. Second one is the requirement. She requires health education regarding diabetic control measures. Third one is the discharge status. She is said to be transferred into your care today. Next paragraph is our present medical history. So, as I informed you in my earlier video, here you have to write like a story from the starting and what is until now it's happened for the patient. So here we can write Mrs. Williams. So hereafter you have to write only the patient's surnames. Mrs. Williams has had diabetes for the past 8 years, for which she was prescribed with anti-diabetic tablets. But she is incompliant to diet control and physical exercises. So this is the first scenario. Mrs. Williams already has diabetes for the past 8 years, and already she is on anti-diabetic tablet she's taking, but it's like she's incompliant to the physical exercises and diet control. So only with the medication her condition could not be managed. Thus, her condition got worsened, in addition to her extra body weight, the body mass index became 32. So the advice and education from an expert is essential for her to prevent possible post-diabetic complications. This may be the reason for her referral. So here the patient is on regular medications, and but she is not compliant with the physical exercises and the diet control. So her condition start to worse. In addition, her body weight started to increase, and now the body mass index became 32. So the registered nurse is thinking that hereafter, if you are not doing anything, her condition will become worse and much more, and there will be more chance to get the post-diabetic complications. So she is requesting an education program from the public health to prevent such complications. So in such letters, this is not mandatory to conclude within one sentence at the last. This is like optional. This may be the reason for her referral. So if you think that your letter it is very small, you can use this one. Or if you need to summarize what all the things you wrote on that paragraph, you can write. Because in case of one admitted patient admission, already we'll start with the patient was admitted with this condition, and we did the diagnostic evaluation and we did the management. Currently the patient is something. If you wrote like that, there is no need for these conclusion sentences. But here it's like generally we are talking about a patient. So here if you conclude within this sentence, it will be much pretty to see. So that is only the thing. That's the last sentence. This may be the reason for her referral. So this is optional. Social history, medical history, and surgical history paragraph. So here regarding Mrs. Williams, she lives with her husband. She has hypertension and on regular medications and has family history of diabetes. That's that's all given in the case note, so nothing more. Here one thing you have to keep it in your mind, presently if the patient has the problem is we have to write she has hypertension and on regular medication and some disease condition which already happened and now it's not there. Example, patient underwent appendectomy, so in this case we can write she had appendectomy in this year, like that. And something maybe example here in hypertension, example in that case not whether if they gave the year, they mentioned the year that it started from 2010, we can write she has had hypertension since 2010. So if the date or the year is mentioned, you can write has had. If not mentioned, you can write just has. And if it is already past now, presently if no, it is not there, you can write just had. Okay, so the past is had and the present is has, and if it is continuing from this specified year, you can mention has had. So here regarding this patient, Mrs. Williams lives with her husband. She has hypertension and on regular medications and has family history of diabetes. The last paragraph is the conclusion paragraph or recommendation paragraph. So this is the expansion of your requirement in the introduction. Example, in the requirement, we wrote in the, you can see that in the introduction paragraph, we wrote the requirement. She requires health education regarding diabetic control measures. So this paragraph should be the expansion of this sentence. So this is the easy way to make our letter correct. So here we are going to write, it would be appreciated. So this is like connectives we can use. It would be appreciated, kindly, please note that, kindly note that, it is essential for her or him, it is vital for him or her, it is important for her. These all are the connectives, we can use it in the recommendation paragraph. So it is much pretty to see good if we start with it would be appreciated, if you could, or kindly. So this is the desirable connectives. Here we can start like this. It would be appreciated if you could provide special attention to Mrs. Williams since she is unaware about the consequences of diabetes. Kindly provide formal diabetic education program for her, including dietary modifications. Please monitor her sugar level in blood and urine as well as arrange a vision assessment every 2 to 3 months. In addition, please note which is mandatory for her to attend suitable exercise program to reduce her body weight. So these are the recommendation as per the case note. So just we can start with it would be appreciated if you could provide. So there's no comma, nothing, you can write like straight away. And here one thing you have to keep it in your mind, always you have to write according to the priority. So as a nurse, how we are giving the procedure to the patient in our department, same way. Here in the case note, the recommendations will be here and there. It can be scattered manner. So you have to pick up everything from everywhere and just you have to organize it before writing the recommendation paragraph. It is better to note that when you are during your reading time, when you are reading, utilizing your preparation time, just when you are reading the recommendation, when you are preparing your recommendation paragraph, you can just put the numbers according to the priority. Example, here the patient has we have to give more importance for the, especially to the program, education program. So first we have to mention the education program, and second one, it is for the monitoring her sugar level, and the last one is the inspection vision assessment. It may be every 2 to 3 months, so it is later on, not like in urgent wise. And the last one is the exercise program. So here we have arranged like 2 things. First one, it is for the diabetic control measures. The next one is the regarding the exercise. So like that we divide into 2. So that's why the first all sentences related to the diabetic control program, monitoring everything, and the last one is for the exercise. But for any other case note, if you see any post operative patient, you can see the first one should be the wound dressing, second should be the medications, third one should be the diet, then physical therapy, and last, if there is any restrictions or any other additional information, the last should be the follow-up or any advices. So like this, we have to prioritize all interventions. Just keep the numbers in your task card so that it will be easy while you are writing the case note, the answer sheet. There will not be any more confusions. So always prioritize the things, the recommendations, and write it like a sequence, so that the reader can understand very easily what you mean. And after writing all recommendation paragraphs, just correlate with your introduction paragraph. In the introduction paragraph, what is your requirement? Double check whether it is expansion or no. So you can make correction by yourself. And another one more thing, you can make correction for your first paragraph, that is a present medical history, with your first introduction sentence. Just like double check whether it is expansion or no. So you can make correction by yourself. And another one more thing, you can make correction for your first paragraph, that is a present medical history, with your first introduction sentence. Just like example here, I am writing to refer Mrs. Beverly William, who has type 2 non-insulin dependent diabetes. So this is the recent present medical condition. You can see whether this is the, whether you are expanding this sentence in the second paragraph, that is the present medical history, because here you can see that in this present medical history we have written everything regarding the diabetic, and what she did, what is her current problem, and what is the thing we need. Everything is written there related to diabetic. So like this only you have to present your writing task. There is a correlation. Always correlate your letter with your first paragraph so that you can find out whether your letter is correct or not. I hope which is clear for you. So this is the format for a letter. The letter for public health nurse. So nothing but every letters are common, but according to the writing task there will be something different. But if you know the basic things to write a letter, which will be easy for all the letters. So try to write the letter in same way so that it will be, I hope which will be very easy for you to crack your Oet writing task. Thank you for watching. Bye. Double check.